3 months of unjust, unconstitutional attacks on our veterans and against critical services of the United States Department of Veterans Affairs have divided this traditionally bipartisan committee, sadly. I hope that today's focus on a matter that should transcend presidential loyalty, ensuring that our veterans have access to robust mental health and suicide prevention resources, will reflect a renewed commitment that this committee will once again faithfully fulfill its constitutional responsibility to serve as an independent check on any presidential administration. Under normal times, the renewal of the Fox Grants program would be an important step in enabling the VA to continue providing critical community-based suicide prevention resources for veterans and to reach even more veterans who need this life-saving care. However, I am concerned that the Trump administration's policies continue to undermine the mental health and well-being of those patriotic Americans who have served our nation honorably. From the mass reductions in force of federal workers, including veterans working on the crisis line, to canceled contracts and continued attacks on veterans belonging to underserved communities, Donald Trump and Elon Musk are intentionally attacking morale and exacerbating the Department of Veterans Affairs' mental health workforce shortages. This threatens the ability of the VA to distribute the Fox grants rapidly. We're talking about real lives, someone's parents, child, sibling, aunt or uncle, grandparent, friend. We cannot endure more chaos at the risk of delaying the provision of mental health care and suicide prevention services. Dr. O'Toole, what specific steps are you taking to ensure that there are sufficient staff and resources on hand to administer the Fox Grant program and to provide timely care for veterans seeking Fox Grant resources?
Thank you, Senator, and thank you for your service as well as for your advocacy for our veterans. It's much appreciated. You're absolutely right. This is about ensuring that we have resources in place and a commitment to making sure that the grantees are going to be as effective as possible. The suicide prevention program reports to me. I have a weekly meeting with their leadership team. These are some of the things that we discuss, and this is a priority for us. If we're going to if it's going to work, we have to make sure that we have people in place to work it.
Well, what are you doing to ensure that they are there? I mean, my own office worked a case of several folks who work on the Veterans Crisis Hotline who were in that mass firing. 2 of them have gotten their jobs back, but one of them still hasn't. And we're talking about people who may not be the ones answering the phones. We're talking about the trainers, the people who train the other folks, the supervisors. Some of them still have not gotten their jobs back. What are you doing to make sure that there's enough people to work those hotlines and the suicide prevention programs?
Well, as I mentioned, Senator, with the Veteran Crisis Line, that is exempt from any hiring freeze, and we've actually seen a growth in the numbers of employees on the Veteran Crisis Line. Something, though, that we have to stay vigilant in ensuring that direct care is not impacted and these programs are able to function at their highest capabilities. So
will you commit to hiring some of those people back that you were fired by Elon Musk?
Well, we're happy to follow up with you on any specifics, by all means, ma'am.
Oh, I think it should be more than just the one people being handled by office. There are many people across the country who have now been laid off, who've worked on veterans' mental health programs. Those people need to have their jobs back, especially if they themselves are veterans. Do you commit to safeguarding and strengthening VA mental health workforce, including making sure they have the appropriate resources and work spaces?
Yes, ma'am. I'd like to speak a little bit to that in more direct terms. It's been referenced several times in terms of the return to office and impact on confidentiality. We are very committed, and our leadership within VHA has been very committed to ensuring that privacy is maintained and confidentiality is maintained, including ensuring that if employees need dedicated private workspace for engaging in telemental health care services and other confidential services that require confidentiality and HIPAA rules are being complied with. When those are not being able to be met, We have processes in place to work with the facility to ensure that either space is found or that there are pauses, appropriate pauses to the return to office. This is critically important. We cannot let this compromise the care we provide to our veterans.
Well, will you commit to advocating for protecting these mission-critical staff from adverse administrative actions, especially if they report that they're not getting the resources that they need?
Yes, ma'am, and we do that now.
Okay, because again, we've dealt with people who've had to take phone calls in their cars in the parking lot because there was no confidential space for them to do their work, their jobs.
And we have mechanisms in place to try to ensure that that is not happening. And if those are happening, we need to know about it.
Okay. Thank you, Mr. Chairman.